Good morning. We're here today to talk about a new paradigm for rural wealth and health for all. And I'm really energized to have this group of people who are so knowledgeable about agriculture and public health to work together for better commodities. And by which we mean those that work in the real world food system and support increasing rural wealth and health for all. And we'll talk about how we're doing this to save government money without costing households and in a way that fully leverages the benefits of the market system around food. We'll talk about how we're targeting a triple win: healthcare savings, increased farmer profit, and healthier communities. As Roy said, this is about a new paradigm, a new shift in how to think about things. So we're going to ask you to listen to what we have to say, to ask questions and participate in the conversations this morning and this afternoon. We don't often get opportunities to really explore something new, however. So I ask you to just take a couple seconds right now, maybe slow down so that you can explore with us before we start. Thank you. As we're starting, if you could make sure that you have a pen and some paper to go ahead and write, we'll use that in a few minutes. We'll talk about how we're saving lives. We'll get a little bit deeper into the science, then we'll talk about the business aspects of this and what you can do to help. I'm talking here as the president of the Foundation for Innovation in Healthy Food, where we're a nonprofit dedicated to saving lives and reducing healthcare costs at global scale. And we're doing that by enhancing nutrition in the commodity food supply. We'll spend a good chunk of today talking about how the Coalition for Grain Fiber, which is our first effort, to increase the level of dietary fiber in commodity wheat. We'll also talk about opportunities in corn and rice, animal-based foods. And the thing is that there's a lot of opportunities here. And this has been kind of developing for a number of years. When I first began at Cargill, directly out of graduate school, I was just kind of curious about all the technologies available to make the foods healthier. But I knew that most of those technologies didn't really fit the business model we had. So I was like, well, what can I do? And then as I got older, I saw more people around me and recognized how prevalent chronic disease is. It's a major problem. But I was healthy. Until one evening, I realized when my sister called and she said, "It's Mom." My mom had been walking across the garden and she bent down to smell one of the roses that she loved so very much. And she had a massive stroke. She died that day. And of course, right then I was focused on family and grieving. But when I got back to work, I was no longer engaged in just making that profit number go up. The question had become, what can I do? And this isn't just me. Today, disengagement in work and life is higher than it's ever been before. You know, in the survey that we sent to a number of people before this roundtable, people said, well, can you link what we're doing now in today's conversation to the next generation of farmers? Because we're not sure where all the farmers are going to come from. And so certainly this afternoon we'll be talking about, increased fiber wheat is a $25 an acre opportunity business. It's really critical. But at least as important is the fact that what we're doing is about linking the actions people take on the farm to how we're nourishing humanity. And that does feel good for people of any age. For the young people, many of them, it's really important. Our aim is to shift the trajectory of national responses to chronic diseases. This chart has American spending on healthcare and on food since 1960. Now, in 1960, Americans spent twice as much on food, that's the red line, as we did on healthcare. And then the food system did some really cool stuff. to ensure that everyone had enough food and it was low cost. Every year, like the yield on wheat is going up like 1.25% year on year on year on year. You think about 1 year and you're like, okay, great. But 10 years is like 15% improvement. That adds up. Now, the food industry has also been creative and they've given new offerings for people to eat. But if you really want the master at developing ways to get consumers to spend more for what they have to offer, that's the healthcare industry. They are the go-to for chronic disease. You go to a doctor and you find out that you have a chronic disease, you get diagnosed with it. And then for the entire rest of your life, you work with the healthcare industry to manage that disease. It's partly a free market portion. One of their key tools is also policy. I think very few people in this room would be surprised that today Americans spend twice as much on healthcare as we do on food. What may be a little bit surprising is the little yellow dot there, which is the amount that government in the US spends on healthcare. That is more than consumers spend on food. And the challenging aspect of this is that that's really inefficient because the cheapest thing to do is to keep people healthy. That's our food system more than our healthcare system. And that's what we're here to talk about. There's free market components of this, there's policy components of this. And I don't know what the governments that were voted in on Tuesday will support, what they won't support. What I do know is that two things will continue to be the case about agriculture and food. Agriculture is an incredibly low-cost, efficient route to enhance the health of the population. And agriculture is also an incredibly powerful tool to reach all socioeconomic groups. And that correct aspects can be reached in many different ways, depending on your political persuasion, your market position in the market, et cetera. So we'll talk more about that. The first question, though, is, does agriculture really have the ability to impact public health? I mean, come on. And the answer is very much yes. The power, particularly of our favorite foods, and we begin with wheat. Wheat is 20% of global calories and protein. It's about the same in the US. And wheat has also proven itself to be able to impact public health. We fortify white flour with little granules of stuff at the end of the milling system. That fortification with folic acid and other things, it cuts birth defects in the US 25 to 50%. Every day there are infants born healthy without birth defects because of this little tiny shift that we've done in the white flour milling. You may not know that wheat is actually the largest single source of fiber in the American diet. It's the source of about a third of the total. And that's important because the more dietary fiber people take in, the lower our risks of cardiovascular disease, diabetes, and other chronic health conditions. So, is there any money for this type of thing? Well, let's first start at a high level. The immense cost of chronic disease provides the beginning of an opportunity. In the US, cardiovascular disease and diabetes is $700 billion a year. That's just a big number to me until I realized that's 50 times the value of the entire US wheat crop. So 2% reduction in those reduces the healthcare and related costs equal to the entire value of wheat in America. That's actually material at a family level too, because that $700 billion is more than 10,000 for every family of 5 in America. So that 2% reduction is $200 every single year for every single family in every single state. And that's those two diseases. There's a lot of quality peer-reviewed articles that relate dietary fiber to additional chronic diseases. In the same way, more dietary fiber reduces the risk of other diseases. They're good quality articles. The burden of proof isn't as high with those as for heart disease and diabetes. So we don't include them in the answer, but the potential value may be significantly higher. So how might this look like? Agriculture and food. We're thinking about a paradigm, a way of looking at things that is learned from history about what actually works with food. We're talking about a modest improvement in foods eaten by everyone several times a day. Wheat is like 4 or 5 servings a day that the average American gets. There's this interesting article from the Center for Disease Control, the most impactful health strategies of the 20th century, the top 10. 2 of them have to do with food. One is the fortifications that we've talked about. You know, little tiny shifts in foods. We talked about the white flour, there's vitamin D dairy, there's other ones that have been really impactful in their eras. The second one is food safety, where you have this set of professionals who are looking at how we produce our food and process it. And every year they make little tweaks in what we're doing, so that it's very rare for us to have a wonderful meal and end up with an acute health reaction that leads us into the hospital. Yes, every few months there is a food safety scare, and they're real and they are serious and they're scary. But when we think about the volume of food that we produce, they're really rare. When we're thinking about how do we create something that works in the 21st century, that approaches chronic disease, that is attractive for farmers and public health people and consumers, we think about the strengths of the food industry. It begins with scale. Let's be real. The top 3 foods that share of the diet globally: wheat, corn, rice. 51% of what everybody eats, the majority. In the US, the top 3, wheat, chicken, sugar, is a third. To those primary grains, globally, we add the main animal-based foods: chicken, pork, beef, dairy. 70% of the global diet. In the US, it's those plus a handful of miscellaneous other ones, and you're at 84% of the diet. A small set of foods that we focus on have the potential to really impact what we're eating. Now, to make this attractive, that science opportunity has to be partnered with business, so that the food industry and the farmers go, yes, I like to do this. This is part of what I do. You need to have financial incentives that build on existing policy, existing business strategies. Yes, and if you look, and we'll talk about them in a little bit, they do exist, and it's not talking about major shifts in the world. It's about taking things that we do now and tweaking them. One of the things that we're talking about is that we certainly celebrate the opportunity to educate consumers, to empower them to make healthier choices. This afternoon in the public health session, the University of Nebraska Extension folks will be talking about ways to do that and to do that better, building on what we're doing. Yet one of the cores of what we're talking about is enhancing the commodity food supply. So it's in the foods that people already choose, without relying on consumers to change their behavior. We also do celebrate the opportunities for entrepreneurial opportunities for farmers and others to create new and really cool products that can be niche or developed for those of us able to spend $75 for a day talking about public health and farming strategy. I think it's time to introduce the star of our show, and it's not me. It's the wheat on either side of me. Those of you who know wheat, it looks like commercial wheat. If you're in the wheat, it smells like wheat. If you grind it up and bake it, it smells like commercial wheat, because it is commercial wheat varieties. We're not talking about something funky, because this is the result of a 20-year path from an EU study called the Health Grains Movement for Better Wheat. And I recently interviewed some of the people who were in at the start of this 20 years ago. And they said that they provided the EU a really inspiring presentation, kind of like the conversation that we had today, and they got funding. And they explained to me, you know, when you get funding of this sort from the EU, you don't have a lot of pre-warning. And once you get the money, it's like you get your pocket's burning because you got to spend like now. And they'd promised to study 150 wheat varieties. So what did they do? The first thing they did is, you know, they looked in their own inventories and they're like, oh, we don't have 150 varieties. But the decision they made then was brilliant. And it really is something that we're benefiting today because they decided to study commercial wheat varieties. So they went to all the seed dealers and the plant breeders across Europe. They got some varieties from China, and they studied 150 commercial wheat varieties. And you know, if it's a commercial wheat variety, it's got to be high yielding. It's got to work in a bakery. And lo and behold, what they found is that the level of dietary fiber in those different commercial wheat varieties differed. Some had low fiber and others had much higher fiber. And so for the last 19 years, they've been going and studying that further and going, okay, is there scientific health support that if we shift these things that will actually have a benefit? In the case for fiber, the answer is yes, pretty solid. Can we benefit the entire population? Well, 98% of Americans eat wheat-based foods. Can the scientists control it? And the answer is yep. So here we are in year 20, making a difference with the Coalition for Grain Fiber. We're talking about natural and innovative and healthy. And for those businesses involved, the goal is to make it profitable. There's two halves of what we're doing. On the left-hand side is the science. Natural science focused on public health at scale. The key thing that the scientists are doing is developing high-quality, natural, increased fiber commercial wheat varieties. There are already commercial wheat varieties in other places, but you know that wheat is a local crop. It needs to be optimized to the local situation. So you got to make sure that that works. There's an 85% likelihood that it can work. It's been done elsewhere. The way that they're doing it is natural variation. You're taking the high fiber varieties of commercial wheat and using those as mommy wheat and daddy wheat. And of course, from that, you get baby wheat with good yield, bakes well, high level of fiber. The dietitians and nutritionists who we're working with say, if we increase the average level of dietary fiber in the wheat that we're talking about, we expect a reduction in chronic disease at a population level. The nutrition models that they're working with, cardiovascular disease, 1 to 3% down, diabetes type 2, 3 to 4.5% down. And every 2% reduces healthcare and related costs equal to the entire value of the US wheat market. Now, how do you get to the right-hand side, which is aligning incentives so it's in the interest of business? We're focused on money for farmers through a combination of policy and business options. Some of them that you'll recognize, some of them are a little bit new, but tweaks. We'll talk about more of those in a second. It has to be low cost because you're talking about food. So on the hard wheat side, we're talking about the current commodity supply chain. Goal is to shift it over. Just increased fiber wheat is what's sold as commodity. Now, we're also talking ensuring by keeping the cost down, you make sure that the current price on the lowest cost staple foods remains the same. Baked goods are some of the foods that those with the lowest income in the US and the lowest income around the world rely on. You can't make those more expensive. Now, again, if those of us in this room get convinced by the industry to buy higher fiber bread because we understand the health impact, well, that's the free market at work. This basic concept has attracted an incredible team. We have on the left side the commercial folks with wheat farmers and supply chain experts in extension engagement, people with knowledge about how the real world works, how real business works. It's key to make sure that what we're doing is real world. And then on the other side, the world-class advisors. You've already seen Dr. Benson. You'll meet Dr. Benziger, both from UNL later. They're world-class experts in their fields. People like Bing Zhao on the bottom right-hand side from Bimbo Bakeries USA, the largest baker in the US and the world. People like Jennifer Yates from Bayer Crop Science, who are world-class, knowledgeable in their areas with a perception and understanding of how the real world works. And these advisors are critical to make sure that we're moving in the right direction. The team of scientists that are actually executing on this, many of them are the exact same scientists advising the industry. They understand how things work. This is under the lead of Dr. Catherine Frells, who you'll meet later from UNL. There are people from 25 states and 6 countries involved in the project right now, 38 plant breeders and geneticists, so you can get a diversity of regions involved. 14 stereochemists and food scientists with industry, academic, and government perspectives. 6 socioeconomists working on the money side. 6 on the nutrition and health side to make sure that we understand exactly what happens when we eat this good stuff. So we've talked about how a combination of good science and a focus on financial incentives has gathered a world-class team to execute. I want to dig a little bit more into that science, where the number one message of this is doable. It's a doable increase in white flour and whole grain fiber levels. This is a wheat grain, and we're talking primarily about the endosperm here. It's about 85% of the grain. It is naturally the source of about 50% roughly of the fiber in the entire wheat grain. We're targeting the fiber in the endosperm cell walls. Now, the endosperm is the part that becomes white flour. So you increase the fiber in the cell walls of the endosperm, and it's in the wheat grain, it's in the white flour, and it's in the white flour baked goods. The endosperm is also part of the whole grain, so it also increases the level of dietary fiber in the whole grain foods. This is doable for the commercial farmer without yield loss. The chart in the top right is actually the original chart from 19 years ago, 150 different commercial wheat varieties. And you can see some of them have really high levels of dietary fiber, some have mid levels, and some have low. They're all, or almost all of them, are commercial wheat varieties. There's a few ancient grains and stuff thrown in just to make sure that we understood the relationships. 19 years of study. You take the ones at the top, those are mommy wheat and daddy wheat for the later variations that we're talking about. That's pretty cool. This could be applied for any region in wheat class. Because the EU folks wanted to benefit society without messing up the cost structure of the wheat-based chain, it's royalty-free. It's also doable for rapid development. Remember how we said commercial varieties have a variation in how much fiber they got? Guess which ones are the first generation of the product that we're talking about in terms of increased fiber wheat? It's these. Existing varieties can be introduced to increase the average level of fiber in the wheat class. In the UK, they recently did a study, and they found that 10% of commercial wheat varieties, just by chance, happen to have the alleles for increased fiber. No one measured it before, but holy cow, that's pretty cool. We're finding in the US elite nurseries that there's variation in the level of fiber in different varieties. So that allows you to roll something out pretty quickly. And then you allow the scientists to do, the plant breeders and geneticists to do what they do, right? They maximize yield and improve it year on year. They improve the bakeability year on year. They can increase the nutrition year on year. For those of you who know, they're talking about executing back crosses in the US right now. We're a few years behind where the UK is. And again, just to get a sense of more of where the science is, they're outlining unaccelerated and accelerated breeding programs. So you can see, hey, depending on how much funding they get, et cetera, what's going to happen. estimated budget, 900,000 to $4 million a year for all the wheat breeders across the United States, and as well as in Mexico, I believe. USDA NIFA grant submitted October 10th. Last year, they submitted the same grant, and they were told, this is the most exciting innovation and technology project in wheat in 40 years. It's high priority to fund it. Didn't get funding, which is interesting, but they're optimistic that tweaking it and resubmitting it this year will provide a positive answer. It's doable for the commercial bakery because it's commercial varieties that we're beginning with. There's also been decades now of Arabidopsis island research. The chart on the top right shows the summary of the research. The top row is hard wheat products for bread, and says if you get increased levels of dietary fiber, what happens to different characteristics of baking? And you see, green, 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 green. Now there's these two yellows, but even the yellows are, if you add enzymes that are very common in the baking industry, those become green. So it's good. The second row here is about soft wheat products. And if they're doughy, like pancakes or waffles or donuts, it's green, 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 same thing. If you're talking about dry things like dry crackers, well, the fiber sucks in the water. And if you're trying to create like really crunchy crackers, that's not a good thing. So on the soft wheat side, it is a little bit more complicated. They understand the basic science here. The science team of experts, some of which wrote the textbooks on this, say that, yeah, we'd really like, $140,000 to $230,000 a year for the additional science here, but it's pretty small. There's 2 USDA grants that have been submitted to begin that process or take the next step in that process. It's also doable for population health. To quote the National Academy of Science, Engineering, and Medicine, underconsumption of dietary fiber is a substantial public health concern for the general US population. The estimate is that about 5% of the US population gets the recommended amount of dietary fiber. In other words, almost nobody. And certainly, amongst hundreds of millions or even globally billions of people, some get more dietary fiber, some get less. Some eat more fruits and vegetables, some get exercise. The amount of incremental benefit for different people will certainly differ. But we expect at a population level, it will be positive. We're talking about a modest increase several times a day because that's how people eat wheat-based foods. This is something that is in wheat. It is an intact wheat component. We're not adding things, so there are no major side effects. Yes, we aim to communicate it. Better wheat, better lives. And there is a potential to have additional messages, more technical ones for some foods. On the science side, now, of course, you need to have fact-based, specific to Arabidopsis island evaluation of low dose improvement, and et cetera, et cetera. So the team has already conducted the in vitro test, where they basically get a bunch of test tubes and they put gut microbiomes, biota in each of the test tubes, and basically feed the test tubes different things, like different diets, some of which have increased levels of dietary fiber. And as a non-scientist, I would go, the results that they got sound pretty intuitive. If you feed gut microbiota slightly increased levels of dietary fiber, you find that the gut microbiome is slightly healthier. There's now mice running around UNL within their little cages as they're supposed to be, but they each have human microbiota to do essentially the same tests and ensure that, okay, in a living thing, you get the same type of answer. They're doing it. The mice are prepared. They need an additional $100,000 to really fully identify what they're doing and really fine tune the studies in the way that to give the greatest insights. But it's there. Some of the things to be aware of is that, yes, there's a human trial coming as the third phase of this, and that's the target. But the team with some really insightful and creative insights from UNMC, as well as others, are also talking about how do you optimize for this specific type of question, low dose increases of nutrition, to get the best insight from the statistics around things and leverage all the statistics available. So that we're not talking about massive amounts of human trials, but something that's actually doable within the cost structure. The question that we get more than any other, is this first step enough? Talking about modest improvements in wheat. I mean, really? Well, it's a step in the right direction for billions of people. More fiber in every baked good, up to 2.5 grams a day. No, 2.5 grams a day is not going to get you all the way up to the recommendations. But you're talking about billions of people. We talked about expect chronic disease will retreat. 1 to 3% heart disease, 3 to 4.5 diabetes. We talked about how this is low risk, really low cost, and so you get like $120 in benefit for every dollar invested. That's in healthcare plus saved lives. And so you invest $100,000 and you get $12 million in return. That's really good. Lives saved from the first introduction of increased fiber wheat. And we've talked about how this is a first step towards follow-on steps in wheat and other commodities and other foods. I'd ask you to take the pens and paper that you got out, though, right now for a second, and write the name of someone that you know whose life has been impacted by chronic disease. It could be a friend, a relative, a neighbor, a loved one. But please take your pen and just write that person's name down. With this project, we expect around the world there to be millions of people who never have the meeting with their doctor where they are told that they have a chronic disease. They never have the meeting with their doctor that says that for the rest of your life, you are going to be working with me to manage this disease, because they're going to be remaining healthy in there. So I ask you, is this first step enough? So we've talked about how this is doable, it's low cost, it's life-saving, because it's a study of commercial wheat. Let's talk about business opportunity for farmers. Bringing high fiber wheat to market is about converting the commodity supply chain with existing business and policy at low cost. And we're going to begin with some of there's 3 aspects of this. Now, first of all, there's policy, business, farm business, and community. We're going to begin with the US and international foods, traditional things that you would recognize. Grupo Bimbo, who you heard about earlier, it's about 20% of the baked goods in the US. It's way more than that in terms of the baked goods in Mexico, which is, of course, a rail car south from the center of the wheat region. They've committed to increasing the level of dietary fiber in all of their products by 2030. Nishin Foods in Japan has said, this is pretty cool. We're interested in increased fiber wheat. You also have, we had an opportunity to have a conversation with our partner, Simit, in Mexico, and they happen to have connections to folks in Kenya. It was an informal conversation, people kind of at the edge of agriculture and health, but we said, this is what we're doing. What do you think? And he said, cool. Keep our people healthier at low cost, saving money in our healthcare system that we don't really have. Dot the I's, cross the T's, and talk to us again. Now, Kenya is not a major export destination for US wheat, but we had the opportunity for the conversation, and we expect you have one conversation like that, there's likely to be others. Also, of course, you're talking about students in targeted communities that are impacted and the ability to get increased fiber wheat to them. Now, the second piece, beginning with the health incentive, we'll talk more about this afternoon, but the 2029 Farm Bill, government saving money with good science. Farmers pay taxes. And many farmers live in communities that are decimated with chronic disease. What we're doing today with an inefficient expenditure of money that's letting people get sick first, when a modest investment in farm businesses that would keep people healthy in their own communities isn't made, that's wrong. This is a better way to move forward for farm communities and for everyone. Of course, if there's money going to farmers, you need to ensure that the baking industry, who gets good yielding, good baking, healthier food, they're not dinging you for that at the elevator. You certainly need leadership from wheat and follow-on efforts from other farm commodities to make that happen. We'll talk more about that this morning and in terms of this afternoon. And you need community support. Some other people before the survey, before this event, asked, well, what are people telling you about what what we're doing? And I think I'll illustrate that with a story that I did an interview at Delaware State University, which is a historically Black college. And it was, a lot of fun. At first it was all jokes and laughing, and then I explained to them what we're doing. And I learned that 3 of the 5 people that were interviewing me were managing their own diabetes. And all of them recognized the impact on their communities of chronic diseases. There are several people from Delaware State University that are participating in our conversation today because they're hosting next year a roundtable, brain fiber to fight health disparities in African American communities, because this is important. I expect that every single person participating today was able to write down the name of someone that they know whose life was impacted by chronic disease. This is part of the human condition today. It brings people together. And yes, when we talk to food marketing people, they say, yes, we fully expect that we can pull together the right story that does bring people together and allow them to celebrate a step in the right direction for all socioeconomic groups. The third area that we're going to talk about later this morning, with Nathan Mueller is going to lead it, is resilience. There are already many opportunities around there to help farmers and the ecology benefit. It turns out that wheat has a lot of really positive agronomic aspects that can enhance farm resilience, that can improve the ecology of the impacts of farming. And if you incorporate increased fiber wheat in that, then you have farmers benefiting, the ecology benefiting, and human health. So 3 different opportunities to deliver on this. We're executing this Coalition for Grain Fiber as a coordinated professional activity at low cost. We have this foundation that's coordinating, connecting, communicating at the center. We like to think of ourselves as a little hinge, because little hinges swing big doors. And what we have in a lot of cases, okay, I guess that got deleted. We have teams. We have plant breeders and cereal chemists and economists doing what you would expect in a project. They're each doing their own thing, but they're coordinated and they're doing all the stuff that's necessary. Many of them, again, are the people working with the industry. Why are they doing this? For 3 reasons. One is so they can go to their current funders because they got a business already, and they go, hey, we're doing really cool stuff, the same stuff we've always done for you. In addition, we're adding value in terms of the commodity that we're delivering. We're saving lives. Can you give us more money? Second reason, so they can go to new people and go, we're doing something really cool for your community, for your special interest. I've never received any funds for you, but can you help make this possible? Third reason, because they're helping to save lives and enhance the way that society works. It feels good. We're also having these things like the roundtables and other meetings with other people on the value side to make sure that all of the pieces work so that we deliver on those targets that we are setting. It's a traditional project, just taking the things that already exist in society and bringing them together to deliver on the value that's sitting right there. This is just a sense of the calendar for the roundtables that we have set up right now. This is the one today. In February, we're going to talk about introducing consumer traits and what we can learn from successes and failures in the history about doing that. It's kind of cool because this is the day before the Wheat Quality Council. And afterwards, we're going to have the industry is going to go through all the new kinds of wheat varieties. And they're going to measure the yield of each one, and they're going to measure how well they bake. And this year, the first time, they're also going to measure what's the level of dietary fiber in those varieties. It's really, really cool to see. November next year, we're talking about the grain fiber to combat disparities in African-American health disparities in African-American communities. We're talking about nutritionists and dietitians, a series of events to gather people's information, help them understand what's going on, help them align their piece to enhance the value for themselves. And because they're part of something bigger, it also benefits society. So how can you get involved? First, helping prepare a path for increased nutrient commodities. It's today, giving your input, asking your questions. We have the website, FIHF, Foundation Innovation Healthy Food.org. Twice a year, there's a newsletter. If you're not on it, go ahead, find out what's going on. We need to be connected to the right events. So again, we have the right conversations with the right people. People know what's going on. Stakeholders, advisors, and board members. Some of the questions that we got in the survey is, hey, I see there's a couple farmers and stuff involved, but do you need more farmers and public health experts and others to participate in this? The answer is yes. It is the people with real world experience, whether they are currently involved or they're recently retired or they're retired, questioning what we're doing, giving us advice. They are worth more than their weight in gold. They are worth their weight in wheat. Collaborating on the roundtables. We need the right people to give us the input, to connect us with the right organizations, to collaborate in terms of organization, getting things organized and funding. That brings us to the last one. One of the easiest ways to support funding is with letters of support. The people that evaluate grants like to know that people like the people who are here today support what's going on. And one of the key people in the industry told me for the last grant, Rod, can you write a letter of support for me? Stick some logos and stuff so it looks like my letterhead. I'll read it, sign it. Took them about 2 minutes, but it made a difference in terms of the ability to get funding from somebody else. Financial support. And if you're interested in writing letters of support, please let us know. We really need to know, and we'll put you on the list to do that. Financial support, whether it's $50 or $100,000. This is not a crazy expensive project, but we do need funding to make it work. That funding can go, and we're happy with it going directly to the university. So they can fund the activities here at the University of Nebraska or at Oklahoma State University or wherever you are, or going through the foundation where it gets dispersed to different projects. They're both fantastic ways to do things. Introductions to people who are interested in what we're doing. So we've talked about how we're saving lives with good science, consistent with business, leading to a world-class team, which is what you want to execute. We've talked about how this is world-class science that's doable. It's life-saving because it's based on studies of commercial wheat. We've talked about how we're building financial support with policy and business strategy, a combination. And that is malleable and adjustable depending on what works. The core being, this is low cost, reaching everyone. How can you help? time, talent, treasure, and introductions. It's valuable to us. We're talking about better wheat for better lives. It's actually about better food for better lives. I now do know at my stage that there's nothing I could have done for my mom. At that stage, she needed healthcare, and having the opportunity to have world-class healthcare is really important. And at the same time, every day there are millions of children who wake up every day to a beautiful prayer. Give us this day my daily bread. And by making that daily bread just a little bit healthier, we're raising the prospects for that day for that children. We're reducing healthcare costs, providing opportunities for farmers to increase the value of what they're doing. And for millions of people, making it more likely that they're going to go to the doctor and not be told they have a chronic disease, not be told that the rest of their lives they're going to manage that disease. So I'll be here the rest of the day participating, and thank you very much for coming down. We'll have some other things, and then we'll have questions and answers and that kind of stuff. Thank you.
Hey, Rod, that was really fascinating. I have a technical question about happens when you change the fiber composition, increasing the arabinoxylin. You wouldn't expect that to affect protein content, but are there any unexpected effects on the glutens and the functionality of the dough?
I'll actually ask you to take the microphone into the row right behind you.
Hi, everyone. I'm Catherine Frells. I'm the wheat breeder for the university. This is something that we are very concerned about. Obviously, anytime you make changes to a major component of wheat grain, we want to make sure it's not going to have an effect on the resulting products. What we can show, at least for hard wheat, which in this region is what we're growing, there's really no significant effects, at least as far as we can tell. We have not done this at a commodity level. So when we're doing baking tests in labs, we're not seeing effects. Part of that is because the arabinoxylins increase water absorption, which is a key thing for us to breed for in this region. We spend a lot of time selecting for increased water absorption. So it's only going to help us. When we're talking about those other market classes of wheat, we have a lot more risk because they're actually, say the Pacific Northwest soft wheat region is actually breeding for low arabinoxylins. So in that case, we're talking about we would need to get specialty products that can handle the higher fiber. So something like pancakes or pancake mixes, things that we use soft wheat flour for that can maybe handle a little bit more fiber. But for our standard bread products, we're not seeing major concerns right now. That's also something that we can adapt our breeding lines for and increase quality to adapt to that higher fiber.
Conrad Leifert, a professor at Texas Tech University, agricultural economist. So it seems to me it's a logical thing to think of anything you eat as a health affects your health. Why haven't we thought about this before?
I think a lot of it is that the measurement was never done. That, it was a surprise. They didn't know what to expect when they began the Health Grains Project in Europe. I mean, is all wheat going to be the same in terms of nutrients, or was it going to be different? And because it was just, that wasn't part of the process. And it's as simple as that. The other piece is just that you do need both sides to work together. You need the science to be good and to make sure that you manage the risks and that Catherine talked about. And you also need the incentives to be aligned. And if you only have the science but no incentives, well, the business is going to go, I don't care. And you got the business, but you don't have the science to illustrate that it's possible. The business is still going to go, I'm not sure this is going to be my priority. You get both. And that's one of the key reasons why it hasn't been done before, is my expectation.
So it's kind of a change in paradigm and thinking process, right? Okay.
We have another question. And Rod, while we're getting that question, do you want to mention what's up on the slide?
Yeah, so we'll ask questions. For those of you, if you don't have your questions answered, you can go ahead and go to that. It's a quick survey. It says, what questions do you still have? Or what questions do you think your neighbors might have about what we're doing? And if you don't get your questions answered now, please fill that out and we'll follow up afterwards.
Hi, Alan Thorson. I'm a colorectal surgeon and president of the Nebraska Cancer Coalition. This question may be better for this afternoon's sessions. I'm not sure, but so one of the issues that comes to my mind is the role of fiber and the issue of lectins or glutens, particularly, you know, Dr. Gundry, and I get this questions a lot because I talk a lot about fiber to patients, of course, as a colorectal surgeon. But Gundry is a cardiothoracic surgeon like Dr. Gold. He grew up in Omaha originally, so he has Nebraska roots. And many of you may know he has this very passionate concern about lectins in small grains, particularly barley, rye, oats, and wheat. So as we increase the fiber, how does that impact the lectins? And is our research working on decreasing lectins in the fiber that we put in? Because fiber itself decreases the risk of some of these diseases, chronic diseases. Dr. Gundry would counter that lectins actually increase the issue because of changes in the microbiome, the leaky gut, and inflammation. So is that something to talk about this afternoon more? Or do you have any comments about those questions? It's obviously a complex issue.
Thank you. We're going to give this to Devin for a second. Devin, do you want to introduce yourself? And then
I'm Devin Rose. I'm a faculty member here at University of Nebraska, Lincoln. You know, we haven't looked at anything like that yet, so something to consider. I guess I don't have much else to say.
So I would just add, just from a conceptual perspective, where the coalition has begun is that we're beginning with the current diet and saying, what can we do from here that would lead to an improvement? And so there is no judgment about what's good, what's bad, what's other things. It's about how can we improve in a way that will lead to positive outcomes. I think that there's many stages that you can go from here to get step by step improvement. I'm not sure that answers some of it.
Yeah, I appreciate that. And I think it's going to be a very, very exciting time considering the election on Tuesday and Bobby Kennedy's role, perhaps looking for a healthier country. But I think that I'm interested that we haven't looked at that yet at the university because UNMC clearly is interested in inflammatory bowel disease and cardiovascular health and the role that your research here may have an impact in looking at lectins and fiber and trying to balance the overall improvement. So I think there's a lot of questions, a lot of collaboration that could occur even at the university here in Nebraska. And hopefully we can maybe discuss that some more.
thank you. And I do think that highlights a point which is very valuable. This is why we have the roundtable, is to bring the perspectives that we may have overlooked, we may not have, but at the same time, we get them out on the floor so we can discuss them. And as we plan better. And that's really what's most valuable. So are there other questions that we have? Brett.
Brett Carver, wheat breeder, Oklahoma State University. Good talk, Rod. Good to see you again. I'm a little bit miffed by the lectin question. I really want to know more about this. Are we talking about amylase trypsin inhibitors, ATIs, what we normally call them? Same thing? Because there is research on ATIs in wheat.
The short answer to that question for me is I don't know what's all involved in the lectins. So that's something maybe needs to be looked at. I think there's a lot of potential. One thing about Gundry's work is that always leaves some caution for me is that he has a product list of about 50 different products that he also markets. So, but I do trust a lot of his basic research and understanding. So I think there's a lot of room to try to figure out how we balance all this out and not ignore that work also. Because I think, again, that's what's coming down the road here. Potentially with Bobby Kennedy's, they're going to have to deal with a lot of these things in the near future rather than the far future.
Okay. Are there some other questions that you might have?
I'll just make one comment related to what you just mentioned, that we have purposefully structured the coalition, that the foundation here that's helping coordinate, we have zero expectation that we're going to grow any wheat. We have zero expectation we're going to mill any flour. We're not going to bake bread. And we've done it specifically for that reason, because our goal is to bring people together so that the people who do all of those things and who represent communities and et cetera can have the conversation, and knowing that our goal is to lead to picking up the value that is not delivered right now and ensuring that everyone gets it.
I just wanted to follow up. I'm glad that Brett mentioned that. So I wanted to clarify, we haven't looked that the lectins and the fiber traits are connected. That's the thing that we haven't looked at yet. So more things to be done in that area.
Well, seeing that we don't have additional questions now, what I'm going to recommend is that we go ahead with the program. And again, if you have questions, you can use that QR code. If you think of anything you think would like to ask, or you think about your friends that might want to ask, feel free to do that. And again, I think on the original slide, there was info@FIHF.org. You can always send questions to us or comments. We would like that too. Now, with that, I'm forgetting who is to introduce Nathan. Is that you, Rod? Well, it'll be me then. How about that?
Why don't you introduce?
Yeah, or we'll let Nathan introduce himself. Anyway, Nathan is an old friend. He was originally with the Extension Service at the university here, before that South Dakota, and he now works with the Natural Resources Conservation Service. Now, do you want to add anything to that? Good. Thank you.